All right, folks. So today is hold on. Fixing to let Oscar in the house. Today is Thursday. Oh, that little back pain from my gallbladder issue is no joke. Just a little slight bend to try to show y'all something. It's excruciating for a second. It's not a lasting pain like you would get from a normal back pain. See, it is Thursday, January the 15th. We're 15 days into the new year. It is 11:11 a.m. Make a wish. So, man. So, yeah. Some of y'all wanted to see how Oscar was. He's at the door. He just went outside to use the bathroom. Now he's barking and won't back in. There he is. There he is. Come on in, Oscar. Tell him how you are. Tell him how. Tell him you're doing good. You doing good? You doing good? Huh? Tell him. I'm doing good. Go here. Tell him. Tell him. I'm doing good. Bounce back. Full recovery. We got his doggy medication. Yeah, done the trick. He's doing good. He's looking good, and he's begging for food again, eating, playing, getting on my nerves. Yeah, everything that you need to have in an Oscar. Oscar. Go get that ball, Oscar. Go get that bone. Go get that ball. Go get your toys. Go get them. Go get them. Go get your toys. Wait a minute. Wait for it. Yep. Give me that ball. Bring me that ball. Give it to me. Oh yeah. We got full-blown Oscar back to life. Vicious dog. Vicious dog. Give me that ball. Give me that ball. If I don't stop now, he'll do that all day. But yep, Oscar good. Oscar good. So I went to the gastrologist yesterday. And here's what she said. Alright, so it turns out, and they did more blood work yesterday. She said my enzymes were elevated when I went to the emergency room. It's weird because I had the attack. I started drinking lots of apple juice upon Cole's recommendation from way back in the sugar diet days. He was talking about it, and then I implemented some apple cider vinegar. So yeah, I got some of that, and the pain subsided after a while, and then like 2 days later, I started the itching because it happened on a Friday. And I went all day Saturday and all day that Sunday with the apple juice. This is back in December. Monday, I started having pains again, and the itching, the consistent itching that I was having. I was like itching all over. That's a condition that is caused by the gallbladder when the bile flow is too crazy. Well, she said, and this is what the gastrologist said. I guess she was got access to all the X-rays and all of the because this is a hospital system, so everything goes into my chart, and I can see all these blood work results instantly. I need to look at yesterday's. I'll let my wife handle all that, so I just have to tell you about it later. But she said, and I've told you this before because I've had a regular doctor visit, and what happened in the emergency room, my liver enzymes were slightly elevated. The gastrologist said she thinks that it's due. She says she's pretty sure that it's due to the gallbladder, because that happens with the gallbladder. This is a stomach doctor, folks. I ain't going against somebody with their expertise that deals with this on a daily basis. She also said that when I done the doctor visit and I got the blood labs there, I was still slightly elevated, but the enzyme levels had went down significantly. So they done blood work again yesterday, which I will have to report back to you on, because this was like late yesterday afternoon. I haven't had any of the itching. Other than, I haven't had any of that itching now in over a week and a half. All of this led to a conversation of her thinking that she's pretty sure, because they don't see any stones in my bile ducts. So Cole's recommendations and treatment worked, and I could have passed several stones, because those type of things happen, and then the bile sludge comes, along with the stone blockage and all of that. It's a big long bunch of stuff. So let me get somewhere else for just a second. Well, it's gonna be loud a minute in here. This is my daughter's space, so let me see if I can get a little bit of quiet going on here. Oh yeah, that's better. That's better. Cut y'all some light on. Now where was I? Okay, so yeah, I was talking about the sludge and the stones in general. She said that I passed those stones. She thinks, and 100% certain, that I passed the stones. I did pass those stones. Now, that doesn't mean that I'm out of the woods with the gallbladder removal, because I am still having pains here from the gallbladder itself. It's weird. It's not like a muscle spasm. When that gallbladder does its little pain and when it's releasing bile sludge, I feel it doing it in slight pinches. If any of you ever bass fished out there before, and you're reeling in your worm and you're playing with it, and you feel that little slight that jiggle when the bass hit that line, and you got just a split second to get him up. That's kind of like what that gallbladder feels like, them slight little twinges. And it's kind of, I wouldn't say intense to the point where it's intolerable, but it's not fun at the same time when it happens. Plus I got this consistent lower back pain now. And all of this can lead to some, you know, funky stuff that she was talking about. Because I said, what if I keep the gallbladder since I don't have stones in the bile duct? She said, I have definitely got, God, I don't know what it's called. It's a gallbladder disease. My gallbladder is to the point now where it's been in there all these years and it's been abused, you know, through food and dieting and stuff over the years, to the point where it's a failing organ in itself. There's a certain type of illness that it's called. Forgot what she said. But anyway, she said keeping it. Gotta remember the stones have passed. They've cleared. Keeping it though, with all the conditions, you know, and the pale stool and stuff like that, she said that yeah, it's definitely diseased. It's got to come out. If you don't take it out, eventually it's going to fail on you and could cause some serious issues and stuff like that that go along with it. She's a gastroenterologist. There's no arguing it. There's no arguing it. It's got to come out. There's no healing that thing. It's something that can just I'm going to have to go to a computer where I can explain it better to you folks, because I can't I can't put it into medical terminology. But anyway, I did ask about keeping it. She said she would highly advise against it. It needs to come out. It is to the point where at some point it's going to quit functioning altogether. And she said, I'm lucky to have made it this long with the symptoms that that I described to her, especially with that lower back pain and stuff. She says she's seen this before. It always winds up to the point where it has to be taken out. But yeah, it's a gallbladder disease. I think I've got it actually saved here on my computer. If I don't, I apologize. Let me go back to it. Yep, I'm gonna have to set y'all up here a second. Gallbladder, the disease. It's cola, and this is why I have the itching. It's the God. Let's see if I can get the phone to pronounce it. I can't pronounce this stuff. Eesh. What is the name for gallbladder disease?
According to Mayo Clinic, cholecystitis is swelling and irritation caused inflammation of the gallbladder.
Cholecystitis, and that's exactly what she said. That's exactly what she said to me. What happens if you have cholecystitis and you do not remove your gallbladder?
If you have cholecystitis and don't remove your gallbladder, the inflammation can return, leading to chronic problems or even life-threatening complications. These can include tissue death, gallbladder rupture, widespread abdominal infection, abscesses, or pancreatitis. all requiring immediate surgery.
Yeah, that's exactly what she said. All of that. I ain't chancing that. It's gone. There's no debating it. I'm sorry. I've done all the things that I could possibly do. I've actually passed the stones. Another thing we talked about was diet. I told her exactly what I was doing. I said I'm doing a plant-based 90% diet, and only having chicken every few days. She said stay away from beef and pork entirely until you get through this. Is what she said. She said don't do anything greasy or anything fatty. She says it sounds like you're doing everything right. I explained about the rapid weight loss, the sugar diet, the whole 9 yards, the stress of my mother, things like that. She was leaning on the rapid weight loss part of it more than anything else. None of my doctors condone the actual sugar diet as far as the soda and stuff goes, but the fruit and the smoothies and stuff, they kind of smile on that stuff. To be honest with you, I mean, there was a lady that I was watching 2 weeks ago. I'll link the video down in the comment section. Who tried to heal her gallbladder issues with the carnivore diet, and it didn't turn out good. It didn't turn out good. It was a 5-month stretch of carnivore to try to heal the diet, and the person doing the interview, was trying to, softball everything, to make it look as if the carnivore diet was a good thing for this condition, and wound up, in a serious situation where they had to have their gallbladder removed. So, I know someone had told me yesterday that they had their gallbladder, and everybody's experience is different. You got to think that this is more than just simple gallstones here at this point. I had those 10 years ago, and this is probably why all of this time, because I've done it in other videos. When you've got gallbladder issues, they can go back a decade, 2 decades, or longer. You can even go your entire life with gallstones and not even know they're there. But once you start having issues, those issues do not go away. Even with the passing of a stone, might get you by a while. And it got me by for a long time, but it's to the point now where it's a dangerous situation if I don't get it removed. There's you hear what she said, the cholecystitis, or however in the heck you pronounce it, all of that stuff, the rupturing of the gallbladder, pancreatitis, it's some nasty stuff that I don't want to deal with. So, and it's my type of luck to get those things. Like I say, I'm not out of the woods. When I wake up in the morning, I feel the gallbladder itself hurting. I feel it. There is no healing it with anything at this point. It's a dead organ. It's like, a really bad situation if it ruptures. A really bad situation if it ruptures. So, yes, I am doing everything I can to keep that from happening. My weight loss has been consistent for an entire week now. Or my weight has been consistent for an entire week now. This morning I hit that scale. Yesterday I hit that scale. I haven't lost any weight or gained any weight since last Thursday. I've got it dialed in. I have some protein, every 3 days or every other, and then do an every other day thing, and I can keep my weight steady, maintained at the same weight. Now that's something I've never been able to do, but I've done it for an entire week now. Usually I'm either going up or down, but this time consistent, steady weight for an entire week. 258.6 pounds. So today, I feel like, I can, some time has went by and I've maintained at a steady weight for an entire week. So I might can drop a few pounds now. Now that we're half the month over. Even though we're half this month over, I still got 10 days into February before I can even get it removed. So removal is what I'm going to be going through. I'm tired of these symptoms. I still can't eat anything fatty or greasy or stuff. It really, really limits you to what you can and cannot eat. So when I'm eating vegetables, I'm fine. When I'm eating vegetables and rice, I'm fine. Beans give me a little bit of an issue. They're a little harder to digest, but they digest just the same, and I can tolerate that, you know. But yeah, it's a situation where, yeah, I am not going to be put at risk for anything life-threatening like a gallbladder rupture. When people's appendix rupture and stuff like that, it's not an issue, right? Because it just, there it happens and you got to have it out. You know, there's no healing it, you know. And that is where mine stands right now. Like I said, she done blood work there yesterday. That should be in my chart. Something I'll be able to talk about again. And she said she suspects once the gallbladder is out, those blood markers will normalize and come down. She thinks it's completely due to the gallbladder issue itself. This is what the stomach doctor said. There is no questioning the doctor. There's not. They're just not. And said that she would like for me to come back in up there and do one more blood test to just see if those levels elevated, which I could probably, my normal doctor's probably going to do that too. I'm not going to go to multiple doctors to get that blood work done. If he does it first, fine. I will go by those results if they have leveled out, you know. I'm not going to go back and pay more money to do the same thing, you know, if the blood markers all come back fine. And even at the worst case scenario, they weren't elevated to a high dangerous level that's going to involve dialysis like kidney failure or anything like that, folks. So let's just get that straight first. And not to mention the fact that the second blood work, they went down a little. So that is what I got to report to you. And the good news is, Cole, yeah, the stones passed. They passed. They passed. It didn't. It's just 10 years, you know, too late for my gallbladder. Just 10 years too late. Cholecystitis. Look it up. Look it up. Let's see. Has anyone ever cured cholecystitis?
There's no guaranteed cure for cholecystitis other than surgical removal of the gallbladder, which is the most effective long-term solution. Other treatments can manage symptoms temporarily, but surgery is the definitive cure for symptomatic disease. For medical advice or a diagnosis, consult a professional.
Already consulted a professional, and yeah, it's just it just is what it is, folks. If you're disappointed, I'm sorry, but I got responsibilities that require me to be here, and yeah, at least we know that, you know, you can pass a stone with apple juice and apple cider vinegar. But it does not cure cholecystitis. Let me know what you think down in the comments. That is all I got for this video, folks. So until the next one, you folks have a good one.